Welcome everybody, and thank you for joining our webinar today. My name is Dr. Lauren Howell, and I'm an Associate Scientist at Burdock Group Consultants. Today I will be discussing antimicrobial efficacy and claims, and how to navigate this aspect of registering an antimicrobial pesticide with the Environmental Protection Agency. I would like to begin with a brief introduction of Burdock Group. We are an interdisciplinary team of scientists, regulatory experts, and project managers that assist clients to find customized solutions to complex compliance issues. We pride ourselves on our two core values, confidentiality and commitment to quality, backed by more than 30 years of experience. Many consultants work virtually as independent contractors, and it can be difficult to hold them accountable and maintain security of client materials. All of us here at Burdock Group are full-time employees working in a brick-and-mortar office in Orlando, Florida, with a comprehensive IT security system to ensure the confidentiality of our clients' proprietary information. Our consulting team is supported by strong organizational infrastructure and project management, and access to extensive resources, including an in-house library. Our diverse catalog of regulatory solutions includes food ingredients for humans and animals, including pets, dietary supplements, cosmetics, hemp, CBD, and the topic of today's webinar, pesticides. Registering a pesticide with the EPA can be a complicated and arduous process. On top of the various steps already required to meet compliance under the Federal Insecticide, Fungicide, and Rodenticide Act and the Federal Food, Drug, and Cosmetic Act, antimicrobial pesticides require an additional layer of testing to demonstrate the efficacy of products carrying claims of antimicrobial activity. Despite the numerous guidance documents and information provided by the EPA, navigating the requirements of antimicrobial efficacy testing can be a confusing endeavor. The EPA defines an antimicrobial pesticide as a product intended to disinfect, sanitize, reduce, or mitigate growth or development of microbiological organisms or protect inanimate objects, industrial processes or systems, surfaces, water, or other chemical substances from contamination, fouling, or deterioration caused by bacteria, viruses, fungi, protozoa, algae, or slime. The multifaceted definition of an antimicrobial pesticide alludes to all of the facets of claims and efficacy testing we will be discussing today, including technological function of products, the intended surface or substance to which the product is to be applied, and the microbial pest for which the product is effective against. The EPA divides microbial pests into two categories. The first are those that are of economic or aesthetic significance, with technological functions against spoilage, fouling, odor production, or biological deterioration, where the presence of the microorganism would not normally lead to infection or disease in humans. Product claims against these types of microorganisms are referred to as non-public health claims. Products that typically bear non-public health claims include slimicides and odor control agents, as well as preservatives, algicides, and other products that claim to control microorganisms for economic or aesthetic purposes, bacteriostatic and fungistatic products claiming to control bacteria, causing spoilage, odors, or stains of aesthetic significance, and treated articles, which refers to items that are treated with an antimicrobial pesticide to protect the item itself, such as incorporation of a pesticide into a paint. For products that bear these non-public health claims, the EPA does not typically require efficacy testing to support these claims. Although the EPA can require efficacy testing for non-public health claims on a case-by-case basis. However, companies are still responsible for ensuring the performance of their products and keeping this information on hand, regardless of if it's required for submission. The second category of microbial pests, as defined by the EPA, are those that present potential public health hazards, which encompasses any microorganism that can be infectious to humans in any area of the inanimate environment. Product claims of efficacy against such microorganisms are known as public health claims and comprise the majority of requests we receive from clients regarding EPA registrations. Antimicrobial products with public health claims include, but are not limited to, viricides, limited and broad-spectrum disinfectants, hospital disinfectants, fungicides, sanitizers, sporicides, and sterilants. The terms used to categorize products bearing public health claims against infectious or pathogenic microorganisms are often interchanged and used synonymously, such as disinfectant and sanitizer. However, each represent a separate claim associated with specific standards for efficacy testing to demonstrate the performance of the product as stated on the label. Categorizing your antimicrobial pesticide is determined by what your product is efficacious against. The appropriate test organism for each claim is specified by the EPA for each type of antimicrobial product. For example, a product claiming to be a broad-spectrum disinfectant requires efficacy testing against Staphylococcus aureus or Salmonella enterica. Some claims, such as broad-spectrum disinfectants, provide options for test organisms, whereas claims such as fungicides designate only a single test organism, or in the case of sterilants, multiple organisms require efficacy testing. In situations where biosafety, ease of culturing, or strain availability is a concern, such as dealing with Mycobacterium tuberculosis for tuberculocidal claims or hepatitis for virucidal claims, the EPA has approved surrogate organisms that can be utilized in place of the primary pathogens responsible for these human illnesses. Label claims for additional microbial pests other than those specified by the EPA is permitted, as long as the microorganism is likely to be present in or on the recommended use areas or surfaces, and the claim is supported with the appropriate efficacy testing. The specific testing methods required to demonstrate efficacy against the designated test organisms are determined by the formulation of an antimicrobial product and the use of the product or surface to which it is to be applied. The EPA specifies certain testing methods depending on whether the product comes in the form of a water-soluble powder, liquid, or gas, a towelette or a wipe, a spray product, which includes aerosol, pressurized spray, trigger, or pump dispensers, a mist, a foam, or a gas or vapor. All of these product formulation types are not included for every category of antimicrobial product, and some EPA guidance specifically calls for agency consultation and protocol review for certain situations, such as spray sterilants and especially for foaming, fogging, gas, or vapor applications. As I previously mentioned, in addition to product formulation, the specific testing methods required to demonstrate efficacy against test organisms are also determined by the use of the product or surface to which it is to be applied. These include food and non-food contact surfaces, hard porous and hard non-porous surfaces, soft porous surfaces such as fabric, as well as water or air. Sometimes the application surface does not influence the EPA-designated test method. For example, in the case of sporicide, application on a hard porous surface or a hard non-porous surface does not alter the method specified by the EPA, but the surface does need to be identified. In contrast, food and non-food sanitizers have distinctly different testing procedures and target test organisms, despite them both being classified under the umbrella of sanitizers. Generally, efficacy testing should address factors or conditions that would normally be encountered with the use pattern or patterns intended for the product, including factors such as the nature of the surface to be treated, the presence or absence of interfering materials, or the number of times a product can be used. Determining the formulation and intended use of your antimicrobial product allows for the identification of the EPA-designated standardized test method to be utilized to demonstrate the efficacy of your product against the indicated test organism. These test methods have specified standards for the experimental conditions that must be followed to meet EPA standards, including product concentration, number of batches of product to be tested, contact time, and evaluation of success. Some testing requires that batches be tested on different days. Efficacy testing of antimicrobial products is typically performed at the lower certified limit, or LCL, to demonstrate an antimicrobial product's ability to consistently perform as labeled. And the general rule for contact time is that the contact time used in efficacy testing should be the same or shorter than the contact time identified on the product label. If you decide to deviate from the recommended methods designated by the EPA, your company or your pesticide regulatory consultant should contact the EPA to determine if you need to submit the modified protocol for review. Typically, Modifications do require review, and therefore a document would need to be submitted clearly identifying, describing, and justifying each modification to the EPA for evaluation prior to initiation of the modified efficacy test. In addition, validation of the alternative test method may be required as well. In some cases, standard method deviations do not need to be formally submitted to EPA for a separate review. Such situations include use of alternative organisms, modifications to support the growth and recovery of these alternative strains, or the use of alternative carrier types. However, your company or representative should consult with the EPA regarding all deviations from the recommended protocols. Under certain circumstances, product efficacy data previously submitted to the EPA can be utilized to support a new antimicrobial pesticide application or amendment to a current registration, thus requiring applicants to only submit a reduced set of efficacy data known as confirmatory data. Confirmatory data may be substituted for standard efficacy testing if the product in question is an antimicrobial product whose formulation is identical to a currently registered product generated by a different manufacturer with complete supporting efficacy data available, to verify that the change in manufacturer or production process does not impact the efficacy of the product. Confirmatory data may also be substituted for standard efficacy testing if minor changes to the inert ingredients are implemented, with no change to the concentration of the active ingredients, so only under the circumstances of an addition, substitution, increase, or decrease in an EPA-approved inert ingredient. Formulation changes that do not require confirmatory data and can simply refer to previously submitted efficacy data include alterations or substitutions of a fragrance or dye that does not exceed 1% of the total formulation. For those in the audience seeking to register a product with claims against the novel human coronavirus, the EPA has announced an expedited review process for all antimicrobial pesticide registration matters related to COVID-19. This includes registration of new pesticide products with virucidal claims against COVID-19 with active ingredients from both registered and unregistered sources, the addition of an active ingredient from an unregistered source to a currently registered product, a formulation change to a currently registered product that requires EPA review of confirmatory data, or addition of a virucidal claim to a currently registered product. Adding a virucidal claim against COVID-19 to a currently registered product that is approved only for sanitizer claims or has no public health claims on the label requires submission of efficacy data to support a base disinfection claim, in addition to efficacy data for the SARS-CoV-2 virus and a non-enveloped virus to support an emerging viral pathogen claim. Adding a virucidal claim against COVID-19 to a currently registered product that is approved as a broad-spectrum or hospital disinfectant only requires efficacy data for the SARS-CoV-2 virus and a non-enveloped virus to support the claim against an emerging viral pathogen. Lastly, I would like to briefly discuss animal disease pathogen and zoonotic microorganism products. These products include those that claim to prevent, destroy, or control microorganisms that cause significant animal diseases. Prior to 2001, when the foot and mouth disease outbreak occurred in Great Britain, the EPA categorized these products under the umbrella of non-public health claims and did not require the submission of efficacy data. After the 2001 outbreak, the EPA voiced concern over the impact these diseases can have on animals, the economy, and potentially humans if transmitted from infected animals. Therefore, the EPA started requiring efficacy data to support product claims against animal disease pathogens and zoonotic microorganisms. As with all unique or questionable cases, your company or your representative pesticide regulatory consultant should check with the EPA for which microbial pests fall under this category. Products that are not animal disease pathogen or zoonotic microorganism products and do not fall under public or non-public health claims are not considered antimicrobial pesticides. These include agricultural fungicide products, aquatic herbicide products, and wood preservation or anti-fouling paint products for which a claim of pesticidal activity other than or in addition to antimicrobial activity is claimed. I would like to conclude with an important reminder that it is essential to perform efficacy testing in accordance with EPA standards, whether the data is required to be submitted for registration or not, as the EPA reserves the right to perform their own testing on a case-by-case basis. While registering an antimicrobial pesticide with the EPA and navigating the efficacy testing process can seem complex and daunting, Burdock Group is here to help. Our experienced team of scientists and regulatory experts can review your product claims and labels to advise on the proper course of action for the registration process and efficacy testing. If you wish to outsource your efficacy testing, we can assist in protocol development and steady contracting and monitoring with accredited third-party laboratories. In addition, Burdock Group offers category assessments to identify the most suitable pathway for your product's EPA registration and can serve as your pesticide regulatory consultant for active and inert ingredient registrations and registration of your company and facilities. Thank you for attending our webinar today. For more information on this topic or any of our services, please contact us at info@burdockgroup.com.